At Dynamic Physical Therapy, we understand the importance of good health. We are a local group of dedicated physical therapists and supportive team members who believe that our community deserves the best possible health care. Our physical therapist professionals excel in helping our patients overcome pain and loss of function by developing effective, individualized treatment plans. And the best part is, we develop these plans together with our patients to make sure they will reach their health and fitness goals. We take pride in delivering personal attention and care in a positive, supportive atmosphere, efficiently and effectively by offering high-quality, one-on-one treatment. Terry Hamp, clinical manager and physical therapist in our Cadillac clinic, knows exactly why she wanted to go into physical therapy. Her grandfather was seriously burned when she was a child.
That kind of encouraged me, and I loved going in there, seeing how much they helped him, how he could get back to function. He was really active.
Executive Vice President Gus Mayes says the majority of the people they see have typical problems. Roughly 60% are back, neck, and spine problems. There are a large number of shoulder injuries because that is a very highly used joint. The rest is filled with hip, knee, and ankle rehabilitation.
It can be Parkinson's, it can be stroke, it could be arthritis, it could be injury, athletic injury, you name it. What we look at is, okay, how is this patient functioning? What can we do particularly to improve their functioning in their daily living?
Seek help sooner than later. After an evaluation and a referral, we will make a personalized treatment plan for each individual patient.
They're excited about it. They come in and they tell you, they're like, I was able to walk, for 2 miles, or I was able to get back to running, and it just makes you feel so good that you can do that on a daily basis with people.
What we find, however, is that physical therapy is often misunderstood.
People really don't understand what physical therapy is, and obviously when they come in, first thing you'll hear is like, oh, it's pain and torture, or it's, give me a back rub. And that really obviously does not give credit to the amount of education a physical therapist goes through.
Whether you're suffering from a specific injury, disorder, or have had a recent surgery, we know that living with pain and loss of function can disturb the quality of your life. This is why our team is dedicated to helping you overcome hurdles so your body can heal properly and you can get back to life as usual, enjoying everyday activities. We work together with our patients, their families, and their doctors to develop individual treatment plans geared toward reaching specific goals. Our strategies often involve specific exercise programs to stretch and strengthen muscles, as well as to improve posture, balance, and endurance. We function as a patient's personal coach, helping you reach your goals and letting you know what to expect during the healing process. With our help and coaching, you can get back to your livelihood as quickly and as safely as possible. The most prevalent conditions that we treat at Dynamic Physical Therapy are orthopedic or musculoskeletal. These are conditions that involve the muscles, joints, ligaments, or tendons of your body. Orthopedic or musculoskeletal conditions can come on suddenly with an accident or injury, or they can develop slowly over time. As the degree of these injuries will vary, our therapists devise individual plans so that each patient will undergo successful rehabilitation. Here's a look at some of the most common conditions that we treat. Hip, knee, ankle, and foot problems are considered conditions of the lower extremity and require specialized care. Ankle sprains, ACL tears, and muscle contusions are extremely common and are generally associated with sports injuries. Other injuries of the lower extremity evolve due to the wear and tear of vulnerable joint surfaces in adults. When considering a rehabilitation program of a single joint or muscle, it is absolutely crucial to develop a program that incorporates the entire kinetic chain. A kinetic chain is a series of joints and muscles working in perfect harmony to produce complex actions such as walking and running. At Dynamic Physical Therapy, we excel at developing individualized programs that incorporate these concepts. By doing so, we achieve optimal results for our patients and reduce the likelihood of re-injury. Shoulder, elbow, wrist, and hand problems are conditions of the upper extremity. The upper extremity functions differently than the lower, so our treatment plans for conditions of each are entirely different. Common injury to the shoulder includes damage to the rotator cuff. Our treatment approach for a rotator cuff problem is to simply remove obstacles that prevent normal smooth movement. Elbows, which are crucial joints for daily activities, may develop injuries like tennis elbow, where the tendons that control the wrist and elbow are affected. The wrist and hand are commonly injured by fractures, arthritis, and carpal tunnel syndrome. Manual therapy and exercise are important in order to allow the joints and muscles of the hand and wrist to resume working in harmony. Often this takes time and considerable effort. Problems related to the spine are both common and troublesome. It has been estimated that 80% of all people in the Western world will consult their healthcare provider for back pain during their adult life. Your body's ability to heal back injuries is very powerful, and usually the pain and limited mobility will disappear in a few days. But if it doesn't, you need expert care, and this is what the physical therapists at Dynamic Physical Therapy are all about. At Dynamic Physical Therapy, we are expertly trained to develop custom treatment plans to help patients overcome back problems. Our approach incorporates those elements that have the strongest support in medical evidence. Most treatment plans consist of education, specific exercise prescription, manual therapy, and various procedures such as traction and electrical stimulation. Our treatment plans are designed after we perform a thorough interview and evaluation. Every patient is different, and therefore every treatment plan should be different too. After surgery, your body has essentially sustained a major injury, and your healing process will kick into high gear. If this process is properly managed and supported, your body will heal well, and the results of the surgery will be reduced pain and improved function. The physical therapists at Dynamic Physical Therapy specialize in developing an optimal management plan for you after surgery. Each phase of healing requires a different set of components in your treatment plan that should be tailored to your specific circumstances. The goal of post-surgical rehabilitation is to help our patients develop an individualized plan that supports the body's natural healing process, to eliminate problems that interfere with healing, and to strengthen and condition the body so our patients can resume normal life activities without pain or limitation. If physical therapy is part of your future, know that you have a choice. Tell your doctor you choose Dynamic Physical Therapy.